Good morning. Good morning. David McCaleb here, and with Jamie Hasty from SESCO, and I'd just like to welcome you. I'm sorry, I introduced us. My name is David McCaleb. I'm with Bankers Insurance. Jamie Hasty is with SESCO. I'd like to welcome all of our clients and clients of maybe you're here because you were invited by one of our sales execs or maybe from one of our owner banks. However you ended up being able to get here, we welcome you and trust that you'll find the information very, very helpful. I'm going to go through real quick some housekeeping. This will be recorded and it will be distributed to everyone who's registered, whether you're able to attend or not. You will get an email with the video link, and so feel free to share that out. And lastly, we're going to do some questions and answers, but as toward the end of the session. But as you think of them, go ahead and type them into the chat box while it's fresh in your memory. And you may see two boxes. One may say questions, one may say chat. Please put them in the chat box. We cannot see what goes into the question box. So the chat box is where you need to drop those questions. And that's it. With no further ado, I'm going to transfer it on over to Jamie.
Hi, thank you, David, and good morning. Good morning to everybody who's joining us today. My name is Jamie Hasty. I'm Vice President with SESCO Management Consultants. We are the oldest HR consulting firm in the country, and we have the pleasure of being partners with Bankers Insurance to provide their producers and valued clients HR-related consulting pieces. So if you are a current client of Bankers Insurance, I encourage you to reach out to your sales team or your broker or account manager and make sure that you have access to SESCO. And if you are not a current Bankers client, welcome. We're happy that you joined us today. And so what I would also say is, before we kind of get into the ETS, this is a very company-specific, very kind of in-depth piece that we're going to cover at a higher level to a degree. So as questions come up, as David mentioned, please use the chat feature and so that we can kind of see those and cull through those. I'm going to try to do that as we go through some of the slides. I'm going to keep my eyes peeled on the chat. And if we don't get to it during that particular slide, we will absolutely get to it at the end, hopefully. We've got a lot of people joining us today, which is exciting. So as you have questions, ask them. If there are things that we need to talk about offline that are more unique or specific to your particular company, position, employee base, we are happy to discuss that with you as well, knowing that there's only so much we can cover in one short hour. And these things can be a little bit in-depth, so to speak. So with that being said, what I'd like to do is I'm going to do a little introduction, and I'm also going to turn off my webcam, so bear with me, and hopefully you can see my screen. But when we talk about the safety regulations, the Virginia Department of Labor and Industry, in conjunction with OSHA, or VOSH, as we call it, Virginia OSHA, they formalized Emergency Temporary Standards, ETS. And basically, this is mandated emergency and safety procedures that employers, all employers, need to comply with. Some of the mandate includes that we provide personal protective equipment, PPE, that we are doing sanitation, social distancing, infectious disease preparedness and response plans. That there is record keeping, there's training, and there are hazard communications in the workplace. If I think back to March when COVID began more actively in the United States, and if you're in Virginia, or maybe even your company is in North Carolina or West Virginia, all of our states really went under lockdown and have slowly reopened under phases. And each state in their phases has different requirements for compliance. So here in Virginia, Governor Northam has the mask mandate, and that's been in place for a while. We've had the social distancing. So some of these things that are found within the ETS are not new. Some of these things we should have already been doing as good, responsible leaders or business owners or just community members in general. So since the ETS mandates requirements that are already in place for many of the respective states, but more importantly here in Virginia, there are also additional things that we need to cover, additional things that they put into place that we've not had to do, and kind of changes the way that we operate a little bit. It is also important to note that this regulation took effect immediately on July 27th after it was published in the Richmond Times-Dispatch. It technically will remain in effect for 6 months unless otherwise made permanent. Now, there is chatter through General Assembly, through the Virginia Department of Labor and Industry that there are likely going to be aspects of this regulation that are permanently enacted. So, you know, a lot of people get hung up on, oh, it's just the 6 months, and then we don't have to worry about it. That's not the case. Obviously, SESCO will be monitoring that and determining whether or not those permanent aspects need to be communicated to our valued client base. The other thing that I want to talk about is that there seems to be confusion on who this ETS applies to. The ETS applies to every single employer in the state of Virginia, regardless of size. I get a lot of questions, at least two a week, about, well, I'm a small business. I've only got 5 employees. I don't have to comply with this, right? And the answer is no. You absolutely have to comply with it. And so there's a lot of things that we'll go a little bit more in depth to as we progress through the slides. So the ETS is going to break down job tasks and employers, or the company rather, and the industry by risk category. And so what you will notice is that we have low risk, medium, high, and very high. Those are your 4 exposure risk levels. It's also important to note that based on your industry, you may be considered medium risk, but when you break it out into looking at each position and each job task, you may have a mixture of low, medium, high, and high positions within your company. So there, again, initially when this was rolled out, employers were very kind of set on, oh, well, I'm low risk. I don't have any interaction with customers, or it's few and far between, so on and so forth. You really have to look not only at the company as a whole, but each specific job. And so that's important. High and very high risk tasks generally are reserved for healthcare, mortuary services, anything that would involve direct exposure with known people who are COVID positive. Typically, traditional office environments are classified as lower risk. Medium risk jobs can involve specialty work, manufacturing, labor, commercial transportation, anything that would really kind of involve customer interaction. Or interaction with the public, rather. So retail stores, exercise facilities, restaurants, breweries, so on and so forth. Again, part of the ETS is going to require that you as the employer conduct an exposure risk assessment to determine which jobs and tasks performed by your employees fall into each category. And if you actually go onto the Virginia Department of Labor website, there is a hazard risk assessment template that makes it very, very simple for you to kind of walk through task by task for each job and determine where does the exposure occur. So let's talk about what these exposure, well, before we get into that, let's look at some of the dates. There are mandatory dates for compliance with the ETS, one of which has already passed and one of which is coming up very quickly. So generally speaking, by August 26th, which was last month, lower risk employees would be exempt from this training. But if you were considered very high, or medium, you should have done your first round of Virginia ETS training with all of your staff. Okay. If you have not done that, you need to do that now. Basically, that training was an overview of the ETS, what it means, what we need to do, what we as employers will be working with staff on in terms of reviewing their job tasks, what the, in essence, risk categories are, so on and so forth. That general training should have already been conducted no later than August 26th. So if you haven't done it, I strongly suggest that you do it now. Again, lower risk companies are going to be exempt from that piece. Now, the second requirement in terms of dates of compliance is that if you are medium, high, and very high, part of the ETS mandates that you develop an infectious disease preparedness and response plan, and that is due by September 26th. You also need to train your staff members on that plan by September 26th. So those are the two hard and fast compliance dates that the ETS mandates thus far. Please keep in mind that this mandate is enforceable not only by the Virginia Department of Labor, but also by Virginia OSHA, and there are hefty penalties for non-compliance. When we look at non-compliance, failure to abate, or just failure to train or have your plan in place can start out, the general fine is going to be considered serious through OSHA, and that is a little over $13,000. Now, if it is a willful or repeated violation, meaning OSHA comes in, they say, hey, you don't have your plan or you don't have your training certificates to prove that you've done these things, or your return to work program is not compliant, and we've already talked to you about that, and we've been here once, and you still haven't done what you needed to do, that is considered a willful or repeated OSHA violation, and that penalty is close to $135,000. Okay, so there is a lot of liability involved with not complying with the ETS, so we don't want to go there for you. But overall, ETS is looking at our duty to protect our employees. Obviously, with social distancing, 6 feet apart, whether that be the employees themselves or even social distancing with customers, if you have a client or customer-facing position. It also requires that we self-monitor. You want to think about either doing temperature checks of your staff in the morning and or developing a self-monitoring sheet, a little form that your employees need to fill out every day or walk through the self-monitoring steps before they come into work. We know what the typical signs and symptoms of COVID are per the CDC. So that self-monitoring checklist really needs to talk about temperatures of 100.4 or more, body aches, flu-like symptoms, cold-like symptoms, those sorts of things that our employees have a responsibility to self-monitor and check before they walk into the door and potentially expose their coworkers. The other piece is that we need to have signage posted. Now, this signage is found on the Virginia Department of Labor, and it's typically a couple of folds. So first and foremost, if you have a retail operation, there needs to be a sign on the front door that says no masks, no service, or something to that effect. And we can talk days about how do I handle when customers or even employees refuse to wear masks or say that they can't. We can talk about reasonable accommodations, and I have a slide that kind of addresses that here shortly. But so you've got to have the mask sign. You need to also have signage that addresses COVID general symptoms, hand washing procedures, and what their responsibilities are in terms of not coming to work sick. And again, these are things that we've probably already been doing in terms of communications from your management down to your staff of don't come to work sick. If you feel like you've been exposed, you need to notify your manager or work with HR, those sorts of things. But this regulation makes it mandatory. You also, if you're medium risk or above, need to offer disposable face masks to your employees and customers. There is no mandate that the employee has to wear your mask. We do get a lot of questions about can they wear their own mask? Is a cloth mask okay? Is a face shield okay? Yes, it says face covering in the regulation as well as in the governor's executive order. But we have to make sure that we have alternatives if somebody forgets their mask, or their mask breaks during the day, or something gets on it. So we need to have backups. There may be additional PPE required, goggles, hazmat jumpsuits, gloves, plastic gloves that we're changing out every time we touch something. There may also be other things that we put into place, such as plexiglass barriers. If you have open workspace or cubicles that we can at least do 6 feet apart, we still need to put plexis on them to make sure that we are limiting the ability of that position and that employee being exposed. If you have front desks or administrative or reception areas, or if you're in the automotive service industry and somebody walks in and we're an auto service shop, and that counter, we need to have plexi barriers. That's really, really important. Same thing with banks. Most of you all probably already have some of those glass barriers in place, but definitely with the loan and the CSRs and that sort of thing, we need to have those plexis up. There's also going to be clean and disinfectant training, so long as it complies with the EPA and CDC list of approved cleaners. There are things that every 2 hours based on your exposure level and that position's exposure level, they need to be going in and wiping down their workspaces and common areas such as break rooms and lunch rooms where we have to limit the number of people that are in there at any given point in time. And then, of course, we have to prohibit infected workers from coming to work. And then we have the other piece of making sure that if they are infected and we're under 500 employees, that, we've got our ducks in a row with the Families First Coronavirus Response Act for the emergency paid sick leave or the expanded FMLA for childcare, and that we're compliant with that piece too. So overall, employers here in Virginia have had a lot of moving parts, both with the FFCRA/CARES Act and now the ETS. And so we want to make sure that we're giving you the most updated information to remain as compliant as you possibly can and make good faith efforts to be compliant. So let's look at the exposure risk levels. Low risk typically doesn't require contact within 6 feet of each other. So if you've got an office environment where you've got individual offices with doors closed, there's a likelihood that I'm not really going to have to come within 6 feet of my coworker or anybody else. I could be considered low risk. Or if we can adjust cubicles and workspaces to spread people out more than 6 feet and put in plexi barriers, we're achieving minimal occupational contact. So these categories, or this risk category really, is limited required interaction. If you've got people that are working from home and nobody's really in the office, then we can classify that as lower risk. Most employers, or a good portion of employers, I would say, are really going to fall within medium risk. This is going to require more than minimal occupational contact inside 6 feet. So, this is not saying occasionally I may run into my coworker in the hall and that hall is not 6 feet wide, it's 3.5 feet. This is more than 45, 50%, or 35% of the day, I'm going to be interacting with other coworkers and or customers or the public. Doesn't mean that I know whether they're COVID positive, but there's a likelihood that one of them could be known or suspected sources of COVID because I've got more interaction going on in my day-to-day. Again, these are retail establishments, grocery stores, manufacturing, anything where really there's a lot of folks and there's a required interaction from the employees to get their work done. Typically, like I said, a large portion of employers are going to fall within this medium risk simply because of the goods and services that we're offering. High risk, there is high potential for the employee to be exposed inside 6 feet. These are going to be, again, healthcare, first responders, support staff, home health, and this is where, look, I'm providing direct client or patient care. So you've got high risk and then, of course, very high risk, EMS, doctors, nurses, anybody that's performing specific medical procedures. So those are kind of your risk categories. Again, it's very important that even if your company is determined to be, medium or low risk, you may have employees that, based on their job functions, or may have additional duties that are moving in and out of different exposure levels. So don't get solely hung up on the fact that just because we're low risk as a company, that I can just blanket that across the board, because that's not the case. So things that we're looking at when we do our hazard risk assessment, the tasks that particular job is doing, the environment in which those tasks occur. That's very important, because, if I have to go to a different department within the business, and I'm outside of my little, enclosed work bubble, I'm being exposed to other employees within 6 feet. We're also going to look at what is the presence of the virus within our organization. What is the likelihood that there would be a presence of the virus, because we're working in person versus virtually, and not everybody can work virtually. The number of employees and the size of the workspace in which they're working. Do we have everybody back 100% in person? Or are we staggering those work shifts to reduce the potential exposure? We're looking at the working distances between employees, the duration and frequency of the exposure, and what hazards may they encounter. Again, all of those things are going to need to be outlined in that hazard assessment that you can find on the Virginia Department of Labor website, and I'll also pull up a sample at the very end of our time together. So for standard requirements, medium, high, and very high, there's required training. I mentioned that. That should have been done by August 26th. You had to cover the requirements of this particular standard, how COVID is spread and what the characteristics of COVID are, general awareness training, and general safe and healthy work practices. Then, once you get the PPE and the hazard risk assessment outlined, you need to cover what PPE is going to be provided or what PPE is required for the position. And then also keep in mind that the Virginia ETS has an anti-discrimination clause in it. So here's what that means. If I refuse to come to work because as the employer, you have not done what you need to do to comply with the ETS or take appropriate measures to provide PPE or increase sanitation efforts or to spread us out or to stagger schedules and that sort of thing, and I feel that it's an unsafe work environment and I say I'm not coming to work and or I make a formal complaint, going through the chain of command about what's going on in terms of the work environment and safety concerns, you cannot discipline me, fire me, or take any sort of discriminatory action against me for that. Let that sink in for a second. Anything that's related to complaints, concerns about workplace safety, making a complaint to Virginia OSHA if somebody thinks that you're not following what you need to follow in terms of both the ETS and the CDC, you cannot take corrective or discriminatory action against that employee. It violates the anti-discrimination regulation or the language within this regulation. And that's really, really important. I can't tell you how many calls I've gotten about so-and-so is refusing to go get tested or so-and-so is, not following their guidelines, or so-and-so made a complaint and I'm tired. They're constantly just that complainer and I'm tired of it. I just want to let them go. These sorts of things are where you really need to kind of stop and take a breath and reach out to somebody like SESCO or another employment attorney and make sure that before you take any sort of action that we've dotted all of our I's and crossed all of our T's, because we don't want to get an allegation of discrimination or retaliation in terms of the ETS. Okay. The next requirement is that infectious disease preparedness and response plan. I also have a template that I'll pull up and show you, but the Virginia Department of Labor has also provided you with a template through their website. As restrictive as this requirement can be, they've done their best to really provide you all with necessary templates to make the transition as smooth as possible. And then, of course, medium, high, and very high, you also need to make sure that we're compliant with the Families First Coronavirus Response Act. So a few things also that the ETS is going to challenge you all as employers to review and or implement if you don't have it. Sick leave policies. Now, keep in mind, Virginia does not mandate paid sick leave. Virginia does not mandate that you provide any sort of leave as an employer. However, what the ETS strongly encourages is that as an employer, you are providing flexible sick leave policies. They also want to see within the company, if you can do it, that we're giving employees the option of teleworking or staggering their shifts. They're also going to want to see administrative work practice controls that reduce or eliminate contact with each other. They're also going to want to ensure that we've got a specific policy in that plan, in that infectious disease plan, that is addressing self-reporting and monitoring of positive test results. Here's a big thing that's different from what we've been doing. If you have an employee that tests positive, any potential exposed employee that would have come in contact with that positive employee within 6 feet for 15 minutes or longer must be notified in writing. Now, here's the key here. You cannot legally give the name or release the identity of the individual who tested positive. This is really important for compliance with HIPAA and other privacy laws. But you do have to notify potential exposed employees of a positive test. There is a sample notification that I'm happy to share with you all via email if you need some sample language. And then the other requirement of the ETS is that you flesh out specific return to work procedures for somebody that has been exposed and or tested positive, whether they're symptomatic or asymptomatic. And we'll kind of break out what those return to work procedures look like, because there are two different strategies that we can take in bringing somebody back to work. You must explore your PPE needs. Part of that hazard assessment, look at the PPE. It may not necessarily be that a mask suffices. Do they need face shield plus a mask? Do they need gloves? Do they need foot coverings or hazmat suits? All of these things are what you need to be looking at in terms of PPE for each position. And then you're also going to want to look at what the PPE is used for, how we're going to clean, store it, and fit it. And so, again, those are going to be based on the present hazards or hazards that are likely to be present. So part of the PPE assessment is that you need to inform affected employees of the process. So managers typically are going to know what hazards potentially exist and what PPE is necessary. But if the employee's PPE is possibly going to change, you need to inform them of that. We're going to review the data, do a walkthrough survey of the work environment, the job tasks involved, determine that hazard risk level, determine what controls are already in place to protect against COVID-19, and look at what additional controls that we need to put in. And for example, that may be that plexi barrier. Once you have that PPE and hazard risk assessment done for that job, you need to keep that on record and make that document accessible to, not only to the employee, but if the Department of Labor or OSHA is requesting it. And then you may have to reassess the workplace as things progress, as our needs change, to make sure that that PPE assessment is a living, breathing document. So there may be some of you all on this call that are considered lower risk. Congratulations if that is the case, because you have much less work that has to get done. And if you're lower risk, the ETS just mandates that you give general awareness training for all affected employees. And really that is more so of wash your hands, don't come to work sick, here are the symptoms of COVID, keep in good communication with your manager. Again, for, Department of Labor on their website has created kind of a general 2 or 3 page, I think it's really 2 pages, kind of sheet that you can quote unquote cover with your low risk employees on what that general awareness is, and that would suffice for the awareness training for low risk employees. Okay, so part of the regulation looks at making sure that we include very specifics as to what coronavirus is. So this slide obviously kind of breaks that out. It's a respiratory disease. We know that it spreads mainly through close contact inside 6 feet, airborne transmission, so on and so forth. So making sure that people aren't like coughing, sneezing, getting too close inside that personal bubble is really, really important. Also, keep in mind that, and kind of in what SESCO does, we hear a lot of feedback, whether it's Virginia employers or not, about, look, employees are pulling down their masks to talk to coworkers or customers or whatever, and then they're putting them back up. That's really not a good practice. So if you've got employees that are taking off their masks, or you're catching them not wearing them, and you feel like you constantly have to remind them to put it back on, or they're pulling it down to talk to customers or each other, that is a very, very easy way for OSHA to come in and say, you're not compliant. You're risking the exposure of your staff, but your customers and vice versa. So really the mask piece is really important in terms of enforcement. And it's a fine balance of, engaging in disciplinary action versus, trying to give somebody the benefit of the doubt. But the mask piece is going to be really, really important for compliance. So if you're running into struggles with, employees wearing the mask properly or pulling them down or moving them off and that sort of thing, make sure that communication and expectation is really driven home for them. Obviously, COVID can affect people differently. So part of your required training is that you have to cover the signs and symptoms of COVID, trouble breathing, pain and pressure in the chest, confusion, and loss of taste, a loss of smell. That's kind of a new thing. Sore throat, congestion, runny nose, diarrhea. Here's the other thing. The season's getting ready to change. Here in Richmond, it is raining, and the last 2 days I've heard so many people, including my own children, complain about allergies. So, use common sense, but also make sure that employees understand what the signs and symptoms are. If there has been an exposure, those symptoms may appear 2 to 14 days after exposure. So a lot of things when we talk about returning to work and testing, a lot of people, if they have been exposed, need to really get tested twice because of the incubation period, especially if they're doing a rapid test. So more importantly, employees, including business owners, if they are experiencing symptoms, need to stay home. If they can work from home, great. But they don't need to be coming to work with any of these symptoms. Obviously, we know COVID could be deadly. Anybody that has a pre-existing condition is at higher risk. This slide, you can obviously see what those pre-existing conditions may be. This information is not new. CDC has been covering that with us for many years, but the ETS just mandated that we also review that with our staff. People may be symptomatic or asymptomatic. And so the other piece of the ETS is that you need to remind people, even if they're not showing symptoms, they could have it and still unknowingly spread it. More importantly, we have to implement work practices and controls. So that requirement to self-report symptoms and conduct pre-screening for signs and symptoms. If you are checking temperatures, what I would encourage you not to do is to write those temperatures down. You don't want to get into a habit of keeping any sort of confidential medical information because from an HR, ADA, HIPAA perspective, any medical information that is tied to an employee or identifiable by an employee needs to be maintained in a separate medical file under lock and key. So if you're screening temperatures, fine. EEOC allowed that per decision making back in April, but just scan it. If it's above 100.4, they don't make it in the door. Don't let them come in, clock in, log in, whatever your timekeeping system may be, and then screen them after they've been there for 20 or 30 minutes. So, again, drive home that they have to report their symptoms and have a person outlined in your plan that is in charge of handling that and how they are to report, whether that's verbally and writing, so on and so forth. Anybody that is known to be suspected to be infected and or exposed is prohibited from reporting to work. And they need, generally, everybody needs to avoid physical contact with each other, at least 6 feet apart, and utilize those face coverings and PPE whenever 6 feet cannot be achieved or maintained. This also includes, so if you've got, I want to go back, so I apologize. if you've got employees who are traveling for work or traveling to and from various work locations. So perhaps your business has multiple work sites, and you've got 2 employees. Let's just for all intents and purposes, let's say you're in construction, and you've got 1 worker and then the foreman that need to go from point A to point B to go check out the additional work site. When they're in the car together, unless they're driving separately, you need to make sure that they've got their masks on in the car, okay? Other control measures, frequent hand washing, we know that. Alcohol-based hand sanitizer, that's at least 60% alcohol. If you can find it, great. I think in terms of obtaining those additional, hand sanitizers, masks, all that stuff, stock has been replenished a little bit better. So I'm hearing from people even across the country that they're not struggling to find those things, but you need to make sure that all of those things are available and out everywhere for employees. Make sure that people, obviously are covering their mouths, so on and so forth, and that you remind them not to touch their faces in general with unwashed hands. There is obviously a list of EPA-provided disinfectants that are approved to use against COVID. So the ETS is going to mandate that you use these EPA-approved disinfectants for bathrooms, common areas, any place that employees may be coming in and out of, and that you clean at least once per day. Now, depending on your risk assessment, depending on the employee job test, you may be needing to do that every few hours. If I look at some of my retail establishments that have customer restrooms, those restrooms need to be cleaned at least every 2 hours with the disinfectant. So those things are going to kind of adjust how we run the day-to-day. Obviously, you need your social and physical distancing. You want to think about the signage, the visual cues, that sort of thing. If you have an HRIS system and you've got everybody virtual, go ahead and upload those things to the HRIS or online platforms anyways. Because here's the thing, even if everybody's working virtually, you still want that information there for them to see for if and when they do come back into the office or need to run into the office to swap out files or what have you. Stagger those work schedules and look at all that controlled access. The entrance posting I mentioned earlier. More importantly, if you've got everybody return to work or even a portion of your folks return to work and you have break rooms, you need to block off tables and limit the number of people in those break rooms at any given point in time. Employees need to be responsible for cleaning and disinfecting their shared surfaces in the break rooms. That's also really, really important. And then make sure that we're washing and hand sanitizing. Wearing PPE, again, dependent upon the hazard exposure level. We do get a lot of questions from clients that are struggling with when somebody is unable or refusing to wear a mask due to medical conditions and or religious needs. That is a case-by-case basis. What I would encourage you to do is make sure that you're reaching out to an employment attorney or somebody also like SESCO to kind of walk through that to make sure that we're compliant with ADA, Americans with Disabilities Act, and providing reasonable accommodations. But also, more importantly, that we're not violating Title VII of the Civil Rights Act for religious accommodations as well. And then if you have customers that are refusing to wear masks, technically per the governor, no mask, no service. Now, we understand that that also comes with its own set of challenges. If you've got somebody, a customer that is older or that cannot physically wear a mask because of COPD or whatever it may be. And so it's a fine balance of not wanting to end up on the 5 o'clock news for, refusing to let somebody into your establishment or, giving them a good service, but also making sure that we're not allowing clients or customers to walk into our place of business without a mask and exposing our employees, because OSHA will have a field day with that as well. Okay, so let's talk about the infectious disease preparedness response plan very quickly. Something that's important is that, again, Virginia Department of Labor has provided you with a general template. Now, there may be things that based on your respective work area, the type of positions that you have, that some of that template is not going to necessarily be applicable. Again, it's a general template that you can work through, but if you're medium with 11 or more employees, high, very high, you need to have that preparedness plan in place. Again, it's not required for low risk, but here's what I do strongly recommend. You should, as a low risk employer, have a generic infectious disease policy in place. Quite frankly, even before COVID, you should have had one in place for flu. Don't come to work with flu. Here's what you need to do, notify your employer, and here's, what general measures we're taking. What I will tell you, and I'll bring it up here in a second, we have a sample infectious disease generic policy that is on the SESCO website that you can get the PDF right now, and I will show you where to find that. Your policy and planning is due by September 26th. It has to outline the name and the people responsible for administering the plan. You need to provide employee involvement in crafting that plan. You'll also want to include your hazard risk assessment, where the hazards and the sources are and what our appropriate administrative controls are put in place for that. More importantly, a contingency plan for outbreak. Here's what happens. If you've got one employee that tests positive, remember we have to notify everybody in our place of work that was potentially exposed. You also have to notify the health department. However, if I have 3 or more employees that test positive at my respective work site within 14 days of each other, so if Mary, Johnny, and Susie all test positive within 14 days, I have to notify the Department of Labor that I have 3 positive tests. Okay, that's a big deal, because when you have to notify the Department of Labor that you have 3 positive tests and there's an outbreak at your respective company, they're going to ask for your infectious disease policy plan. They're going to want to see it. They're going to want to see that you have all of your signage. They're liable to come in and kind of do a mini audit, so to speak. So, this is really important to put in place. You also have to have the hand washing, your cleaning, and your workforce and visitation or education piece outlined in the plan. How you will identify and isolate potential exposures, your process and procedure for employees reporting. You also need to have a process for your contractors, vendors, and subcontractors of notification of exposure. And then you're also going to want to follow and check the ETS against the CDC guidelines. And make sure that we're compliant with all Virginia executive orders. So there's a lot of work involved with this ETS. It's not awful, but it's just a lot of administrative time in getting all of the information together in one place. We talked about the anti-discrimination piece. Again, you can't force employees to wear the company-sponsored protective equipment or the face covering. They can also wear their own. And, if somebody makes a complaint about a concern about our infection control related to COVID, you can't take discriminatory action towards them. Employees' right to refuse safe Unsafe work environment, again, we can't discharge or discipline an employee who has refused to complete an assigned task because of reasonable fear of injury, aka being infected, or death. When you do your training, or when you have done your training on the ETS and your infectious disease policy, you need to have a certificate of attendance. The employee needs to sign it, and it could be an electronic signature, that's fine. Date it, and then who the instructor was. So, with that being said, I know I've covered quite a lot about the Virginia ETS, Emergency Temporary Standards. So with that said, I do know that, David, we've got quite a few questions. I see them popping through. I'm going to turn my camera back on. David, do you want to turn your camera back on and we can go through some of these?
Absolutely.
There you are.
There I am. So we had several questions come up through throughout your talk, and so there's a lot of engagement. That's great. And there, if you want to, you want me just to run down from the top to the bottom?
Sure.
Okay, so the first one we have from Helen Calfrin, and what if they haven't done the training until after August 26th?
Yeah.
What I heard you say was just go ahead and get it done.
Yeah, I think so. Just go ahead and get it done. Again, life happens. We're all busy. We've had a lot going on, but you want to make sure that you go ahead and get that ETS training done as soon as you possibly can.
And then Robert Thomas asks, doesn't a self-monitoring checklist fall under the medical records category requiring long-term retention program of 30 years?
Well, the 30-year is workers' comp. Medical records associated with an employee file only needs to be maintained. Let me rephrase that. General medical information like FMLA, general doctor's notes like, please excuse Jamie, she has the flu or COVID this week. That's going to go underneath the general medical record that you would maintain 7 years after the employee has been separated. The 30 years only applies to OSHA and workers' comp. So great question. What I would say is the employees don't have to turn in that checklist. It can just be a check, 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 and then you just ask the general question of, Jamie, did you self-monitor this morning? And I can just say yes, and I come on in. I have a lot of companies that are doing 2 separate checklists. So more of a specific checklist that the employee does at home, and then more of a generic checklist that I, Jamie Hasty, attest that, yes, I did my self-monitoring checklist this morning at home prior to arriving to work, and I'm clear to come to work. And then they sign that and leave that generic checklist with the identified individual. So then we aren't really in charge of specific identified medical information.
Jennifer Odell asked, basically, and there's several others that are asking for, hey, are there a copy of the slides? Trying to find out, basically a copy of the checklist or the slides, are they going to be available? And if so, then, I mean, we will send out a follow-up along with the link to the video to everybody who was an attendee or if they weren't able to attend. Let's see, a question from Liz Howard. If an employee is the only person on the floor working, do they need to wear a mask? Is there a chance it can get into the air system if they don't and infect other people?
Yeah, that's a great question. So Liz, without knowing what industry or you know, how that potential employee working on the floor may interact with customers, I would say if there is any likelihood that another employee or a customer could walk in, yes, that employee needs to have a mask on. At the very least, as soon as somebody walks in the door, that they immediately put it on. What I would also say is there a chance that it could get into the air system? Yes. Again, we could have gone really, really in depth with some of the engineering controls that are outlined in the ETS that will mandate certain air purification for more so for medical, air handling systems. There are controls and requirements there in the ETS for that. But I would say typically a normal HVAC unit, is probably not going to suck it in and spread it out. That's not to say it couldn't happen. Who knows? But I would say as long as you're taking reasonable measures, we're wearing masks, we're disinfecting, that you should be generally okay.
There were a couple questions. This one from Lisa Moore, but a couple questions regarding the link to the Department of Labor, the
Yep.
risk assessment. If you can, tell you what, if you can share that with me, I'll make sure that when I send out a follow-up email, I'll include that.
Yeah. So can you still see my screen, David?
Yes, I can.
Perfect. Okay. So DOL. I'll send you the link as well, but it's Department of Labor and Energy, Virginia.gov. So here's the specific DOL page. They've got the 47 pages of regulation. If you have not printed that out and read through it specifically, you should. I will say I've read a lot of federal regulation, state regulation in my 15 years. And this one actually is pretty simple to read, understand, and interpret. It's pretty cut and dry, so please do that. They've got news releases. They've got your training certificate form. They've got 9 steps that you can take to achieve COVID ETS compliance. They've got a frequently asked questions. They've got everything here that you really need, okay? They've kind of pretty much wrapped it up and put it on a silver platter for you. But here's the link, and I will also make sure that David gets it when I give him a copy of the slides.
Well, thank you. One more from Jean McCusker is an employee. If an employee states they are taking time off for childcare, do we have to proactively tell them about FMLA, or is it enough that we covered it when it first came out?
Yeah, that's a great question for Jean. So here's a few things with FCRA, and what she's referring to is the Family First Coronavirus Response Act. So if I am taking child care due to schools or my daycare being closed, or my regular caregiver is unable to care for my child, I qualify, generally speaking, for up to 12 weeks paid Emergency Family Medical Leave Act, FMLA, 12 weeks pay at 2/3 of my pay for that week. And there's ways that you have to average out the hours of the work and then what their pay is. But here's the other interesting thing. So Virginia, we're back in school as of this week, depending on where you are in the state. Some people went back at the end of August. So if you're private schools or what have you. The FMLA is also going to apply for families who are currently at home with their children doing virtual learning, being back at school. So if you have somebody that says they're taking off time due to childcare issues related to COVID or schools or what have you, yes, you need to issue that FMLA. It is the employer responsibility to engage in that process. Common misconception about family medical leave in general, whether it's due to the expanded FMLA paid leave for schools or regular FMLA for pregnancy, serious health condition, so on and so forth, is that the employee has to come and ask for it. That is not true. Department of Labor has been very, very specific for 20 or 30 years that it's the employer's responsibility to identify situations that may qualify under FMLA and start that process moving. So with the FCRA EFMLA, let me take you here to the SESCO website. So if you haven't been on the SESCO website, sescomgt.com, there's a COVID-19 resource banner at the very top. If you click on this, there's a recorded webinar on FCRA. There is information about reopening businesses. Everything is going to be dated so you know when it was put up. But in terms of the Families First for the paid sick leave and paid family leave, there's an overview and a staff recommendation here. And then here's all of your required templates that you'll need. So to Jean's point, and one of the questions of requesting it or proactively telling them about it, she should be proactively telling them about it and then also getting them to fill out a request form, which is also here. That includes the child care provision. Also make sure that you've got your poster displayed for FCRA. That's really important. That should have been up a long time ago, but it needs to be up with all your other employment posters. So there's a lot of information on the COVID-19 resource tab, specifically related to paid sick leave and paid family leave.
Well, tell you what, why don't we do this? Because I'd like to continue because there's still a lot of attendees on, even though we've kind of been a minute or so over. If you wanted to kind of, if there's anything you wanted to say kind of before we wrap it up, but then continue on, if it's okay with you, as long as people have time, we could continue to go through these Q&A. But if there was any like closing comments or remarks that you wanted to say before we continue on, and then those that have a hard stop at 10 o'clock could drop off, and we could continue on with the rest of the Q&A if that's what you'd like.
Yeah, that's fine. So I think a couple of things. I know that the Virginia ETS sounds a little scary. It's a lot of work. We understand that. If you have questions, please feel free to reach out to me. I'm happy to address those. If you're a banker's client, you have the ability to access SESCO as a client benefit, which is a really, really huge deal, an awesome client benefit that Bankers is able to provide you. If you're not a Bankers client, I'm still happy to talk to you and we can explore other opportunities. If you need help, we're pretty flexible in what that looks like. So if you have questions, feel free. I'm gonna give you my cell phone number. It's area code 804-931-6281. Don't share that with people. Don't be giving that out. And then my email is Jamie, Jamie, at SESCO, S as in Sam, E, S as in Sam, C-O, M as in Mary, gt.com. Feel free to email me or call. And, we'll work through it. I think the biggest thing is familiarize yourself with the regulation, re-review the slides. If you haven't done your training, go ahead and do that. Work on your infectious disease program and do the best that you can. You want to make a good faith effort to be as compliant as you possibly can within the timeline, okay? And certainly, just try to get as much information and that information put together as you can. But again, if you have questions, let us know.
Well, thank you so much. And there are still a lot of folks that are on. So let's, if okay with you, if you've got the time, we'll keep on marching through though.
That's great.
Here's a good one from Robert Thomas. Does the required notification of exposed employees include some subcontractors who are working in and around our personnel? Is an email notification adequate?
Absolutely. Yes. So email is fine. Rob, if you need a templated language for that, reach out and email it to me. Or you know what? I tell you what, I'm going to just give it to David and he can send it out to everybody and then everybody has it. Yeah. Any contractor or subcontractor that would have been potentially exposed by that positive individual also needs to be notified, just as you would have to notify any other employees that may have been potentially exposed as well.
Okay. Bonnie Reynolds asks, And it says we're a small construction company, is the employer if the employer were to send possibly infected employees to the doctor for testing at first sign of infection and then again tested 14 days after exposure. One second, I need to reread this question. Is employer to send possible infected employees to the doctor for testing at first sign of infection and then again tested 14 days after possible exposure? Do we treat, she goes on, do we treat this as a work-related workers' comp event? And is the employer responsible for all testing expenses? And one more part of it, is the employer within its rights to require a doctor's note clearing an employee for return to work?
Great. Okay, so a couple of things. I'm going to try to break that down in the way in which she asked it. And those are all fantastic questions. So to Bonnie's question, first and foremost, if you have somebody that is potentially exposed or showing signs and symptoms, they don't come to work. You need to instruct them to go get tested. Most doctors are going to say, get tested now, come back in 5 to 7 days, not 14. Generally, I have not seen a doctor's note that has said, come get retested in 14. They typically say, get one test, and then 5 to 7 days later, get tested again, because that's generally the incubation period. So yes, they have to get tested. And bear with me, I'm reading through this again. Do we treat this as a work-related? So unless you can prove that that individual truly was exposed at work, it's not workers' comp. Okay? Employees have lives outside of work. They could have been exposed at Target, at Kroger, running down the street because it's a beautiful fall day, you know, so I would not treat it as workers' comp. Certainly if you have a strong inclination or a feeling that it is potentially a workers' comp, my advice would be to speak with an employment attorney such as SESCO prior to submitting it to workers' comp, okay? And then, is the employer responsible for all testing expenses? Yes. So typically, if you offer health insurance, the health insurance is going to cover the COVID test. We can't force employees to pay for their COVID testing. A lot of places are doing free testing too. So, and then, is the employer within its right to require a doctor's note clearing the employee to return to work? So a couple of things. In your infectious disease response plan, you're going to have to mandate whether you do a test-based strategy and or a time-based strategy. And so the safest thing to do, quite frankly, is use the test-based strategy. That is 2 negative tests taken at least 24 hours apart. So those negative tests and or a doctor's note attesting to negative tests is enough to bring them back. Now, here's where state and federal law does not necessarily play well together. DOL is saying we can generally request a doctor's note clearing them to return to work, but we can't force them. Because when the Families First Coronavirus Response Act first came out in March, early April, the testing system was so overloaded that people could not get doctors to write doctor's notes to keep them out or return them to work. So DOL stance is very different. What I will say is, per your infectious disease response plan, you're going to have to outline time-based or test-based approach. And if you're using the test-based approach, you're going to have something from a doctor to prove. You can't just take the employee's word. But also in terms of discriminatory action, don't push too far. It's hard. There's got to be a level of trust to some degree that we're giving to our employees that they're doing the right thing. That's a great question from Bonnie.
So Amanda Tugwell she's got a couple questions here, and so it centers around wearing masks on construction sites, inside and outside. It looks like she's asking for some clarity on what's required and in that particular situation?
Sure. If you've got employees that cannot physically be 6 feet or more apart, whether they're indoor or outdoors, they need to have masks on, period.
Okay. And then, let's see, Sarah Simoneau, do employers have to submit this plan to the state?
No.
Okay.
They do not, but I will say your plan needs to be readily available in case anybody from the state wants to see it.
Gotcha. And actually, she submitted that just a few seconds before Lisa Frazier asked the same thing. So that was good. Okay. And I think I'm getting down toward the bottom here. No, we've still got a few of them. Let's see, Sherry Owen, based on all your information, do you have any thoughts about which mandates may be permanent after 6 months?
Ooh, that's a good one. Listen, if I were speculating, I would assume, and I hate to do that because Lord knows what Virginia DOL will do. I would assume that the return to work piece is probably going to stay. They're probably going to keep the general policy in place for flu or COVID and how you should have appropriate workplace controls. And I think the notification of exposure will likely stay.
And then, let's see, I'm going to read through this real quickly. Owen Brennan, can employees self-screen for COVID symptoms upon arrival? Can this be done with an online questionnaire completed daily?
Yeah, you could, but then again, keep in mind, where is that information being housed? Who's got access to that online questionnaire? Does it violate HIPAA, PHI, and internet privacy laws? So you absolutely can. I think there are some vendors out there that have created that. I'm not saying that I necessarily recommend online forms like that because I think there's additional liability that comes into play with internet privacy laws and HIPAA and those sorts of things, but you could if it was created and stored appropriately.
Okay, fantastic. Another, Sherry Owen, where a mental health industry and therapists see clients they would be high level, but would that make other employees a higher level because clients could come in the office?
Sure.
All righty, let's see, one or two more. Jamie's number again, please, from Elaine Radcliffe.
Sure, it is area code 804-931-6281. Full disclosure, if you call me, you may hear my children in the background doing school and my chocolate lab barking. So I apologize. Poor David's heard it plenty of times.
No, that's great. Appreciate you being willing to share that. And last one that I have here is from Cindy Grace. What if the employee quits to stay home with their child? Do I still offer FMLA?
If they quit, no.
Okay.
No, but just know we could do a whole nother topic or webinar on unemployment. But know that if they quit to stay at home with their child due to COVID, they are going to be eligible for Virginia unemployment plus the additional federal stipend of $400 per week.
That's all we got then.
Awesome. Awesome. Well, I really appreciate everybody joining us today. And gosh, we still have a lot of people on the call, so that's exciting. Thank you, David, for the ability to present this information. I think it's really important. And please know that SESCO appreciates our partnership with bankers and all of the folks there. So I hope everybody has a great afternoon and look forward to hopefully seeing you guys soon.
Absolutely. Thank you, Jamie, for all your time, all your help, and thank you for all the attendees. And until next time.
Yep. Sounds good. Thanks.